Hello, thank you for being here. My name is Kimberly Williams. I'm a licensed clinical social worker. I work at the Andrews Institute at Children's Health. I'm a senior behavioral health care manager. Today, we're going to talk about mental health considerations for athletes and the unique stressors that they are faced with every day. So to start with these unique challenges, the common concerns that we see most are anxiety, depression, suicidal ideation, ADHD, eating disorders, and substance abuse. The unique stressors that come with these diagnoses are balancing academics with rigorous training schedules, managing high expectations, physical injuries, overtraining, concussions, sleep disorders, and social identity pressures. So in addition to these training schedules, the athletes are faced with trying to keep up with the expectations set by coaches, set by teammates, set by their parents, and their own expectations for themselves. And today, there's so much pressure for these athletes to perform at such a high level. If they are faced with some mental health considerations, they are at higher risk for these being more intense and to be facing the symptoms of these concerns at a higher level, intensity. The question we ask is, why do athletes often avoid seeking mental health help for these issues? To start with, they're often worried about others' perceptions. I see a lot in the clinic, patients are ambivalent to treatment. They're worried about their shared location on their phone and who's seeing where they're at. And they're going to find out that they're seeing a therapist or a psychiatrist for a mental health concern. There's often a denial of the problem. An athlete's state of mind tends to be, I can handle it on my own. I'm strong enough. I physically can do this sport. Why can't I mentally handle the challenges that come with the sport as well? We all know about the stigma around mental health. I do think that in the past several years, probably the past 4 to 5 years, the stigma has lightened up a bit with professional athletes coming forward and talking about their success in seeking treatment for mental health concerns and the importance of treating the entire person and not just focused on the physical body and the physical training aspect of the sport, but also taking care of the mind and the mental aspect and the importance of that mind-body connection. And if there's a disconnect there, that they will not be as successful as an athlete as they want to be if they're not taking care of their mental health as well. Lack of knowledge. So there's often just a lack of understanding of what these diagnoses mean. And also the fear of possibly being diagnosed with a mental health disorder and understanding the statistics and how frequent athletes have these comorbidities together with the physical aspect and the mental aspect, and understanding the treatment path and the options that are available for care, or negative past experiences. So I do see this a lot also in my practice. Patients have seen therapists in the past, either a school counselor, a play therapist, or a therapist for potential trauma in the history, and maybe didn't have a great experience with the therapist and are a bit hesitant to come back and see a therapist, especially when it has to do with their sport and them as an athlete. They want to control what they can and keep their sport close to them because it is so much of who they are. So finding the right therapist or clinician for the athlete and building that rapport is extremely important for the success of treatment and mental health with athletes. I want to talk about the types of stigma. This is very important. So the public stigma is, what do others outside of ourselves, our personal biases, think about mental health struggles and the treatment of mental health? Whether it's a negative attitude towards it, or a coach has a strong opinion about it, or one parent over another, or guardian who is not agreeable to mental health because of cultural considerations, again, previous experiences, possible parental or guardian negative past experiences, and having a stigma about what they went through and kind of where they're at, and avoidance of the problem at hand. And then again, that internal, that self-stigma of how we see mental health. I think the first thing that athletes need to do if they believe that they're struggling, but are resistant to seek treatment because of their own stigma, then what are we thinking or putting out to our teammates who might be struggling as well? So a lot of times that internal stigma and struggle comes from our own judgment of others who might be seeking treatment or possibly judging them as a protective measure, and then not allowing ourselves to be seen and to get treatment for what we're struggling with. Again, the perceived stigma. So the belief that others, believe that mental health might be seen as a weakness. And in most sports, athletes are seen as very strong physically, and they typically kind of pair together the mental aspect of it being strong too. But the mental aspect is what we often don't see to the eye. So we don't really know how others view mental health unless we are talking about it and being educated about it. The harmful effects of stigma, so many harmful effects. So it prevents families about possibly talking about it and having open conversations with exploring and seeking treatment and creating a safe space and environment to get the help that they need. Avoidance of the problem, which will make the mental health challenge even louder in your head. If you're avoidant or resistant to these intrusive thoughts, they don't just go away. You can try to think that they do, but they'll come back even louder. And so talking about it, educating yourself about it, having a safe space to talk about it is crucial in breaking down that stigma within the home. And then not addressing the mental health concerns before it does become a serious problem. So what we also see in the field, again, avoidance of treatment to the point where an athlete or a patient is struggling so internally with mental health struggles that they turn to other means of compensatory behaviors such as self-harming. With eating disorders, we see the behaviors of binging and purging as a means of control to mask the emotional thoughts. They turn it into a physical danger to themselves, possibly if it goes on for too long. Proposed to impact access to physical health problems. Again, if an athlete is struggling deeply with a mental health concern, a behavioral health concern, they might avoid seeking help for their physical ailments that they're experiencing in fear of a provider recognizing and acknowledging that there might be something more behaviorally going on. Again, we consume so much unhelpful and wrong messages from the media. The media lies to us all the time. Social media lies to us all the time. Being aware of where you're getting your data from, your facts from, and what sources are educating you on these mental health concerns for athletes, and really seeking professionals to clarify any questions or concerns that you have instead of, again, social media or any sort of platform where they're not, clinicians or licensed professionals. And again, those stigmas, the public stigma leads to the self-stigma. So if you're not sure how you feel about mental health or your own mental health, you might err on the side of teaming with what the public thinks or what you perceive the public thinks about mental health and seeking mental health treatment. And then the long-term effects and the role of shame. I always say that shame and guilt are the two most difficult emotions to sit with, especially shame. Shame is, it's a belief in the past of something we should have done or wishing we would have done differently. And so avoiding mental health treatment, the longer it persists and goes on, and the longer you delay care, there might be some guilt and some shame in not getting the help that you needed and waiting so long, or getting the help that you needed and just the fear of shame, the fear of the shame existing. So signs of mental health challenges, a lot of these you may be familiar with. It's important to pay attention to them and see if they're impacting the athlete's performance in their sport, their ability to do normal daily functioning, taking care of themselves, and maintaining relationships. So we start with the biggest one, which is withdrawing from previously enjoyed activities. So if you see an athlete who is just not enjoying the things that they used to love and have so much passion about, that is the first sign of there's something deeper going on. They need some intervention and some tools to work with these depressive or anxious traits that they're experiencing. Sleep and energy changes. Sleep is huge with mental health challenges. There will be a disruption of sleep. Mostly with anxious athletes, they have a difficult time falling asleep and staying asleep, or waking very early in the morning with the mind racing and ruminating over thoughts. The more depressive sleep traits are sleeping more than usual, taking long naps in the day, disrupting the typical sleep schedule, so staying up very late and sleeping until very late in the morning. We're talking noon, 1 o'clock, and then repeating that cycle because they're so tired and they lack the energy that they need. Excessive worrying, so worrying about possibly one thing or multiple things, or a catastrophic worry where the worst case scenario is going to happen to you, and not being able to break that cycle or stop it or shut it down. Appetite and weight changes. So typically, again, with the anxious athletes, you'll see a decrease in the appetite because their brain is working so fast that they're hyper-focused on the rumination of thoughts and worrying that they don't eat. And with depressive traits in athletes, you see a little bit of both. You'll see an increase in appetite because they'll eat to soothe. They'll eat as a coping mechanism, or they'll sleep through meals, or they'll avoid meals where they're going to have to interact with people or have social conversations. And then a decline in academic performance. So for our student athletes, you will see typically our athletes are type A, and they're very high achieving, high performing in all aspects of their life. And if you start to see that decline in academic performance, it's typically related to a mental health concern. And then uncharacteristic emotional outbursts. So a big emotional response that is not appropriate for what triggered them. So typically it's irritability and anger outburst. They become unreasonable to, process through thoughts and feelings, and they start to get just very angry, mad, and it's difficult to come out of that emotional state when they're in it. Start with anxiety. So the signs and causes. So nearly 1 in 3 adolescents experience anxiety disorders. Anxiety is a big umbrella, and underneath that umbrella are a lot of different anxiety diagnoses. Half begin experiencing anxiety around age 6. That's what patients report. Typically, there's some attachment with going to school or some social anxieties, possible there's some eating anxieties around food, eating food outside of the home, and also some performance anxiety, both with sport and in the classroom if they are students. So the signs, apprehension, so fear-based. They make decisions out of fear. Their decisions are not grounded in what the wise mind knows. It's grounded in chaos and fear of possible outcomes that are in the what if category. The what if this happens? What if this? So feeling apprehensive just to make decisions for themselves. Feeling powerless. So anxiety is a big, big dark cloud, and often anxiety can control our thoughts, can control our emotions, and we feel powerless in regaining that control, regaining that power over our thoughts, which is where treatment for anxiety is so helpful. Patients, athletes learn coping skills to manage the negative thoughts that we are attaching to, and then therefore having an emotional response to, and reframing thoughts and taking control over our thoughts instead of our thoughts controlling us and controlling our choices that we make. A sense of that impending danger or doom. So again, that fear of what if the worst thing happens, that worst case scenario. Athletes who don't experience anxiety find this to be very foreign to them. If you're not somebody who's naturally anxious or at risk for anxiety, that fear of a catastrophe, worst case scenario is going to feel very, irrational. But to those who do have anxiety, it's very terrifying and can be paralyzing to the athlete. Physical symptoms. This is usually the first way that athletes notice something's not right, because the physical symptoms will impact their performance often as, again, an athlete. So the rapid heartbeat, so not being able to slow down your heart rate after you're done competing or practicing, noticing those fluctuations in your heart and feeling your heartbeat, like when you can feel it in your chest or almost hear it. That's a sign. The rapid breathing, not being able to get control of the breath, not being able to breathe in through your nose, out through your mouth. It's more of a mouth breathing, which is telling your nervous system that you're in a fight or flight mode because there is something that is scary to you or that you're afraid of. Sweating. Sweating is a big one. If you notice sweating outside of typical practice, again, competing where sweating would be appropriate, just the thoughts are creating that visceral response, and sweating is one of them. Trembling, so a little bit of shakiness, like you notice that you're a little bit unstable. It looks like kind of unable to get control over your physical body, just a bit shaky, like unstable, a bit on your feet. Weakness, just feeling weak and tired physically because you become eventually drained and a victim to your own thoughts, to where you're just so exhausted you can't keep up with it anymore, and fatigue. So anxiety, risk, and protective factors. So the risk factors for anxiety: history of sports injury. Again, we see this a lot with our athletes who get injured while playing sport. The fear of return to sport is probably one of the biggest chief complaints that I see in clinic, especially with patients' concussion, ACL, the fear of re-injury, the fear of returning to sport, getting injured again, and having forced retirement from sport and not being able to play sports again if there is re-injury. This is probably the biggest risk factor that I see for mental health concerns. High risk of ADHD, and of course, the high risk of fear of failure. Protective factors: high mental toughness and satisfaction with sports participation. So if an athlete is overall satisfied with the expectations that are set for them and feel and find satisfaction in their outcomes and the results, regardless if it's a win or a loss, they are typically protected from these mental health concerns when it's related to sport, not in the greater picture of life, but when it is sport specific. They have that protection over their brain and their mind and their body, where they know and can decipher between, a good loss versus a bad loss, or a strong win, or what did I learn from this? And a lot of this is like learned behavior, and it's learned through educating themselves, getting treatment, talking to providers and professionals, or previous treatment that they've had in the past. Interventions for anxiety. So understanding anxiety, recognize the emotional construct, the unique properties of anxiety. Key components: it's the cognitive, so it's the thoughts about the future. Anxiety lives in the future. It's all about what could happen, what might happen, what if this happens. And those are the thoughts that we have, and our thoughts are automatic, and they happen all the time. And it's a negative thought that lies to us, that we attach to, that we believe, and then we have an emotional response to that. And that emotional response is what has us follow with an action, whether that, because the action is to offset the feeling, because we're not comfortable feeling anxious. So we'll either avoid getting back on the field after we've been cleared to return to sport, because that will erase the anxious thought, because the action that we took was avoidance. So it's the cognitive triangle. It's thoughts and feelings. The arrow goes both ways. Feelings can create more thoughts. Thoughts can create a feeling. And then what we do with that negative response is the action. And if an athlete does the action, as in avoid return to sport, or, does some compensatory method to feel better, then it reinforces the belief of that thought that was lying to us. So it's this triangle, and we have to break the cycle. We have to break the thoughts and the emotions and the connections between the two. And that is what cognitive behavioral therapy is. It's reframing the negative, unhelpful, lying thoughts that we are told to ourselves every day. And it starts with thought awareness and being aware of the thoughts. If we don't know the thoughts that we're having, that we're attaching to emotionally, we cannot break the cycle. And this is, again, what you will learn in therapy. These are the coping skills that you will take on and use, not just in sport, but in facets of life that go beyond just the person as an athlete, the person as a whole. Effective interventions, so basic treatments, interventions, referrals, and the best support that you can get for anxiety disorders. Let's talk a little bit about depression, the signs and causes. So poor performance. If you notice that an athlete is just performing outside of their usual, body's potential, or how they typically show up to practice, their attitude, their body language, something to look out for. Again, fatigue, athletes looking tired and not having the energy and the hype that they usually do when they show up. Getting sick more often. So if we're feeling depressed and experiencing depressive symptoms, it can take a hit on our immune system, because the mental health aspect of it's going to affect our appetite, it's going to affect our sleep, and therefore our immune system is going to be at risk for more illnesses and viruses. Injury. So if an athlete is experiencing depressive thoughts, invasive thoughts, doubt, again, fear, then they are going to be more prone to getting injured. They're not going to be more intuitive to what they know to be true about themselves, and they're going to compensate in some way, and that puts them at a greater risk for injury. Longer recovery times from any practice or training that they typically would bounce back from, like the lack of drive or desire to do self-care and recover properly after a competition, a match, a meet, and just wanting to avoid any care of the body just because they don't have the energy because of the depressive symptoms. Again, the withdrawal. So withdrawing from teammates, withdrawing from, team or sport, social events that are going on, not communicating with teammates or the coach the same. So keep an eye on that. The quietness, they're going to go quiet. They're going to be withdrawn because they're going to be in their thoughts. They're not going to be present in the moment. Personality changes, again, we talked about this earlier, the emotional outbursts that come with hiding or shielding depressive or anxiety symptoms will be loud. There will be, again, those irritability moments, the very small bandwidth to be able to deal with any sort of adversity. Irritability, the sleep disturbances, we talked about this, the change in eating habits. Pay attention to your athletes. Notice if they make comments about food or their feelings around mealtime. If they excuse themselves from the table, if they're not doing, team dinners anymore. Definitely a red flag to look out for these athletes. Concentration problems. So having a difficult time, even watching a TV show outside of being an athlete, if they cannot sit and enjoy a TV show that they used to love or a series that they were once very, attached to, noticing that, or being able to read or finish a book, those types of things, because their mind is wandering to the invasive, intrusive thoughts that they cannot concentrate on what's in front of them in the present moment. And then substance use and abuse. So keeping an eye out for athletes who might be vaping or drinking alcohol at parties. Teammates, be aware. Athletic trainers, if you hear conversations while you're working with these athletes, red flags, just to know that keep an eye on it and, make sure. Substance use and abuse is typically an athlete's way of coping, maladaptive coping skills. So causes of depression, so life events, often triggered by significant life changes and events. Depression, of course, there is a biological component, and it could be organic and dormant, and then an athlete gets injured and depressive symptoms start to come to the surface that they previously didn't experience or didn't feel or notice. So noticing if there was a life-changing event, a life-changing injury for the athlete, which can feel catastrophic to them in the moment, and noticing what sort of the core reason for the change. And then, of course, the genetic factors, hereditary, linked to serotonin levels in the brain, influenced by genetic predispositions. So interventions for depression, similar to anxiety, so combination therapy and medication. The first line of treatment is going to be talk therapy. If an athlete is flagged as maybe having depressive traits or in a depressive state and has not ever sought therapy for it, the best practice is to start with therapy first. Probably about 4 to 6 sessions with a therapist. It takes a while to build that rapport. And once they are in 4 to 6 sessions and a therapist, patient, athlete, parents, family don't feel like the athlete's getting better or they're seeing the results they want, then the next step would be a medication evaluation for an antidepressant or a mood stabilizer. Again, the best practice is the combination of the two, but we do typically want to start with the least invasive intervention, which would be the talk therapy. To stay in my lane, I'm not a medical doctor, but with antidepressants, they do take 2 to 4 weeks to notice any kind of change. They have to get into our system. They cannot be stopped abruptly. They need to be taken rigorously at the same time every day and managed by an adult or a guardian who can make sure that the patient is taking the medication safely. And oftentimes, the medication can give a patient a little bit of a mental boost to be able to participate in therapy better and be a better patient in therapy. Sometimes the depressive symptoms get in the way of patient success in therapy treatment. Common medications are the SSRIs, commonly prescribed for anywhere from moderate to severe depression. Most of you have probably heard of the different SSRIs. To name a few: Zoloft, Prozac, Celexa, Lexapro. Those are the most commonly used and prescribed SSRIs for my athletes. Helpful interventions for mental health challenges. So social changes, social withdrawal, irritability, again, changes in appetite, sleep, and academic performance. Consider seeking help if these behavioral changes persist for 2 weeks or more. So we don't want to see 2 weeks or longer, but to really, address it with the athlete, the symptoms do need to exist for about 2 weeks, because at any given time, we can have a response to a bad practice or a coach giving us negative feedback or an injury. So the time frame of the symptoms is really important in this consideration. And then the reframe therapy, which is the cognitive behavioral therapy. So viewing therapy as a tool to make the athlete a stronger person all around, which will then in turn make them better at their trade and their craft, their sport. And again, educating them on what reframing therapy looks like. And for athletes, what we see is that once they learn what cognitive behavioral therapy is and how they can reframe their negative thoughts to more positive ones and have a positive outcome as an athlete, they like that. They want that control and power over their own thoughts versus the thoughts controlling them and impacting them as an athlete. Once they learn that skill, that tool, it's almost that light bulb of like, wow, this is really cool. I can do this. This is something that I can control, that I can do the hard work on in addressing these symptoms. And then this approach, again, for student athletes, it benefits them in multiple areas of life. It's not just in a vacuum as an athlete. It goes on to various areas of their life as they grow older and go off to maybe university or have careers. These tools are in their tool belt to use, not just as an athlete, but again, in relationships and multiple scenarios where they can use these skills. So coping skills, just to list a few, outside of the reframing of the thoughts. So deep breathing and mindfulness. My preferred method of the deep breathing is to breathe in through the nose, counting while you inhale slowly, hold it at the top and pause, try to get in a little bit more. And then you exhale, counting as if you're breathing out through a straw. slowly counting, and you want the inhale to try to match the exhale if you can. If anything, you want the exhale to be a little bit longer, just to rid all those toxins that are at the very bottom of our lungs, because we walk around breathing all day long, but we use a very shallow part of our breath most times. So that deep breathing gives us fresh oxygenated blood to all of our organs, our brain. It's a rush, right? And also, if you are breathing in through your nose, it tells your central nervous system that you're okay. You're not in trouble. You're not in fight or flight mode. I always use this with my patients. If you think about being in the woods and a bear is chasing you, do you think you're going to be running away from the bear, breathing in and out in your nose, out your mouth? No, it's sprinting, right? So the breathing in through the nose does signal that central nervous system that you're okay, you're calm. And I also recommend doing these breathing exercises not only when you're on the field, at a meet, competing, but as you're falling asleep at night. So get your brain to learn how to do this breathing so it becomes natural. So when you really need it in a moment of panic, distress, when you start to do it, you associate this breathing with, I've done this before, I was in a safe space, and I'm going to be okay. Guided imagery, visualizing your favorite place or things. This is extremely helpful. The conscious brain can only hold one thought at a time. So if you focus on some form of imagery, whether it's you as an athlete doing your sport successfully from start to finish 3 times in a row, and I say, if in doing the imagery you fall or you have a negative response, you start over. So positive imagery, guided imagery is extremely beneficial. The research shows that it is very helpful for athletes in particular, especially before or going into a competition where you're feeling very anxious or nervous about an outcome or a result. Stress ball, so anything physical, touch, like the senses, the 5 senses, a fidget ring, again, a stress ball, anything that you can tactile touch to bring the thoughts to what's in your hand. Again, grounding techniques with the 5 senses. This is another one of my favorites. If you're grounding down within the 5 senses, you are noticing what you're smelling, notice if there's a taste in your mouth, what do you hear? What are you touching? Is there something that you're holding in your hand? I also like picking a color and finding 5 things with that color in the room. What this does, again, is keeps us in the moment. It forces us to be present and not be worried about future events or future outcomes. Self-care, of course, this is one of the most important. Sleep, social connection outside of your sport, engaging with friends and family that are not connected to your sport, having a break in the routine and taking a kind of mental time out, a brain break from your sport and from competition. And then there's music therapy. I tell my patients this all the time, make a playlist of songs that remind you of a happy moment from the past. Tap into that part of your brain where you hear a song and you're like, oh, I remember this from 6 years old. It played at this time and it's happier time, right? So music therapy, make playlists intentionally and specific to, whatever it is that you're going into, if it's a competition or a long travel day or a recovery mode where it's, quieter, calmer songs. There's a lot of power behind music. So helpful tips for parents and coaches, and of course, athletic trainers and nurses. So recognize the self-imposed expectations that these student athletes hold and be vigilant of the mental health issues and signs. I think it prove to be very helpful, especially with those who are on the front line working with these athletes every day, 5-6 days a week, is to be aware of the athletes' expectations that they have for themselves and what's being set for them. And if it is just a huge expectation that is impossible, having those conversations with them. Lead and motivate with positivity. I know that this isn't always possible as coaches and parents, but aligning with the athlete and their goals and what they want for themselves. This is their life. We understand that it is driven and powered often by parent, guardian, coaches, and teammates. But at the end of the day, this is their story and their narrative, and they need to be on the same page with you with their own goals and what they want. I always ask a patient, what is your why? Why do you do the sport that you do? What are your goals? What's best case scenario? Okay, well, let's meet in the middle. What do you want to do today? Let's talk about that. Just meeting them where they're at. Encouragement without being overwhelming, watching how many questions that you ask. One of my favorite things to say is to an athlete, do you want my support or do you want a solution? And that will completely change how you address an athlete and how you speak with them about their concerns or statements that they make, letting them take a moment to decipher what they think they need and what they need in that moment. If they're not looking for a solution and they just want to be heard, they're not going to hear anything that you say. So watching those questions, it's very easy, especially for a parent, to want to just drill with questions one after another. It's being aware of how your child, your athlete is responding to those questions, and notice when they start to kind of withdraw or shut down. Creating a safe space where feelings can be explored and processed without judgment or pressure is huge. So a safe space is, again, simply listening with the intent for the athlete to be heard, not listening with the intent for you to respond. Listen so they feel heard. That will make them feel safe. Validate them, even if we don't understand why they're feeling a certain way. Validate, that must be really difficult to feel that way. Can I offer some support, a solution, talk through it together, meet them again where they're at, so that they feel like they do have some control over their mind and where their mind's going. It's going to be very challenging for them to broach that subject and to feel comfortable in even the safest environments. It's very sensitive information that they're sharing with you, and some of their deepest thoughts and feelings. Awareness is crucial for early intervention. So if you see something going on with your athlete, your child, creating that safe environment to start having those conversations, educating yourself on what early intervention looks like, so you are able to tell your child, your athlete, what that looks like and what's available to them. You bring them in on that process. Again, asking questions. What do you need from me today to feel successful? What can I do for you? How can I help? The other question I like parents to ask their athletes when they're having invasive thoughts is to ask your athlete, your child, is that thought helpful or is it hurtful? And then process that response. If they think it's helpful, let's talk about why that's helpful. Let's put our thoughts on trial. Let's see if we have evidence to believe that those thoughts are true, or if we're clinging to an irrational thought that is creating emotions that are then having us react and respond from a fear-based position. So here is a list of some emergency resources. Again, if you know somebody who is having suicidal ideation or homicidal ideation, thoughts of wanting to hurt themselves or hurt others, this is immediate danger and they need to be seen in an emergency room. Somebody needs to call 911. We cannot sit on this. If you have an athlete even making passive comments about wanting to hurt themselves or others, it needs to be taken seriously. Even if we as a subjective adult think that it's attention-seeking behaviors, it's not your job to decipher that. And we need to keep our athletes safe. That's the first thing that we have to start with. So here are a few of the emergency resources that you can use. Of course, the National Suicide Prevention Lifeline. There's mobile crisis teams all over Texas. A few of the county provided mental health resources in the event that an athlete or child doesn't have insurance. And again, the crisis text line is pretty powerful for these athletes who, this day and age, they only want to text. There's somebody 24/7 that they can text to that they're having a crisis or they need more help or more intervention. Thank you again for joining me today. I've left my email address. Please feel free to reach out if you're needing additional resources or you have more questions about what I presented today. I'd be happy to help. And let's just take care of our athletes and our kids.